Thank you very much, Doc, for your time here on ENCA. Now, first of all, why would the farmers, the Black Farmers Association of South Africa, accuse you of such?
No, thank you very much for having us this morning. I mean, we've been having numerous engagements with them, and I think there is a lack of understanding of the Act. There's also a lack of understanding of the role of the regulator in all of this. So there are a number of role players in the cannabis value chain, and there is a need for a South African.
I'm not sure if you can still hear me, Doc, but you were still explaining the legislation around the issuing of licenses about cannabis. Just tell us about that legislation around that. I believe that it's not that easy for SAPRA to be able to just authorize somebody to have cannabis for food or any other product.
Yeah, so our role as a medicines regulator is that we regulate cannabis or CBD and THC when it's used only for medicinal purposes. So when it's in a food product or it is used for recreational purposes, it is not within the mandate of SAPRA. And a number of the applicants are wanting to use it for recreational purposes, and that's not within our mandate. That is the Department of Justice as well as the Department of Agriculture.
Tell us more about, for instance, the fact that this debate around medicinal marijuana in South Africa in particular, that's still continuing even after that constitutional court judgment about the use of it in your personal capacity.
Yes. And I think there's a number of stakeholders that needed to amend their various legislations and their various acts to align to the Concord judgment. In our case, what we've had to do is to amend the schedules. So instead of having CBD and THC as a much higher schedule that makes it restrictive, we've amended it. And so we actually had a webinar recently where we indicated that where people are making general claims about it, general health claims, we regulate it as a Schedule 0, which means it's like a complementary medicine. You don't need extensive clinical trial data. But if you're using it and you claim that it cures cancer, etc., then you need to, it's a Schedule 4, which means you must then do the required clinical trial. So we've met our requirement as SAPRA. The Department of Justice is still busy with their act. I'm sure you're aware of the act that was presented in Parliament quite recently. So there is still a lot to be done by the various stakeholders.
So how is marijuana actually being distributed here in South Africa or sold? Is it only in food? Is it for, as you say here in your statement, psychotropic? It's a psychotropic drug. What does that mean?
So psychotropic substance is the one, that would give you a high, so to say. And that's usually the THC component of it. There is another component called CBD, the cannabinoids. Those are the ones that would typically have these medicinal benefits. So what we're doing, now that we've amended the schedules and the minister has gazetted these, we're now, very soon we will be issuing what we call a call-up notice, whereby all the products that you would see in a Discan, a Clicks, etc., that are making general health claims, they would need to be registered with the regulator. So we're busy now amending our regulations. We will put them out for public comment, and we've been engaging with a number of stakeholders in this. So at the moment, we don't have a registered CBD or THC product. We do have, however, those manufacturers that are cultivating the crop that do have permits from us, and those that are even looking at export markets that are cultivating the crop, and they do have permits from us.
Doc, while I still have you on the line, let's talk about Johnson & Johnson and the U.S. Now lifting the ban on the distribution of that COVID-19 vaccine. I know that SAPRA last week or the week before was saying that South Africa should not halt our trial on the Johnson & Johnson vaccine. I'm sure you welcome the decision by the U.S.
Yeah, so what we've done is we've lifted the pause on the study. We've had engagements with the various, with the Sisonke team as well as Janssen, and they've met all our requirements for stringent regulation, for stringent monitoring and screening of the participants. So based on the data that we've received for the Sisonke study, we've lifted the pause. We are, however, still waiting to see the data, that will come through and the decision of the FDA. So we continue to monitor all of this.
So basically, we will continue with Johnson & Johnson as part of our vaccination drive here in South Africa.
Correctly, yes.
Now, Doc, I just wanted to also just have you, while I still have you on the line, there's quite a lot of people, of course, South Africans who are now not very trusting of the vaccines. There's a lot of conspiracy theories doing the rounds, and now with the Johnson & Johnson information and this blood clotting disorder, what would you say to South Africans who say they don't actually want this COVID-19 vaccine because of the news that have come out now?
Yes. So, I mean, what we will be doing, and I think the public must have comfort in that us as the regulator as well as the ethics committee are really keeping an eye on these vaccines. And also what we've done is for all the vaccines, we've insisted on what we call post-market surveillance. So there's very stringent risk management plans that the manufacturers have put in place, and they will be reporting to us regularly. And so, it is important that we continue to monitor this. We've recently launched what we call a mass safety app, and this is a platform that the public will be utilizing to report any side effects, and we will be monitoring that, live, so that if there's anything that comes through that needs our immediate attention, we're able to address that. So I can confirm to the public that, we will be monitoring this, and if there's anything that comes through that requires us as a regulator to either pause the rollout or to look at the data, we will do that. So there must be at least that confidence by the public that we are assessing this. We're working closely with the Department of Health and, other stakeholders to make sure that we keep an eye on these.
All right, Dr. Boitumelo Semete Makokotlela, CEO of the South African Health Regulatory Authority. Thank you very much for your time.